Okay, thank you all for being here tonight, and thank you to the Alzheimer's Society for having me. I think this is a great thing to come and talk about risks for dementia and what we can do to minimize them. I'm going to talk about social isolation a bit and how individually and collectively we can try to cultivate social connectedness. So approximately 10 to 25% of older people in Canada and worldwide are what we'd call socially isolated. We're going to get into what that means, but it's a risk factor for all kinds of things, as Dr. Wells was talking about. It's a risk factor for poor health, like mental health conditions, physical health. She was mentioning stroke and heart conditions. It's a risk factor for being hospitalized generally. If you're socially isolated, you're more likely to enter long-term care, and you're more likely to die just by being isolated. Things like loneliness, small number of social contacts, poor quality relationships, those things are all risk factors for dementia. So what does it mean exactly to be socially isolated? And there's lots of ways to talk about it. Part of it is that it can be temporary. You can just be temporarily isolated and feel lonely. You may have lost a spouse, for instance, and that's just a period of your life that you might go through. It can also be persistent, a pattern of feeling lonely and feeling isolated from others that has persisted maybe throughout your life or throughout a number of years. There's objective and subjective parts to it. So there's things that you can count about being socially isolated, and there's things that you feel about being socially isolated. So some of the things are, you might feel like you don't belong, or people that are socially isolated might feel that way. They might feel lonely. They might have limited engagement with other people, limited social activities that they're doing. There may be a small number of social contacts, so that's one of those things that you can count. But the more important thing is the quality of those relationships. So you might have relationships, people in your life, but you don't have a great and a strong relationship with them, and that's contributing to social isolation. So there's other things that people get into, I think, when they're feeling socially isolated. They may feel that they're invisible to others. They may feel devalued and marginalized. It's stigmatizing to feel socially isolated. People don't want to admit to it necessarily. You might be fine saying, I have diabetes, but lots of people don't want to go around and say, oh, do you know what, I'm lonely. And that's really unfortunate. So this is how people might talk about it if they were feeling isolated. They might say, I'm lonely. Or they might say, I need someone to talk to. Or, this is a good one, they might say, I wish I had more things to do with others. And so I've done some work looking at people's reports of loneliness and other things, and about 45% of people in my studies will say things like, I wish that I did more social activities, whereas a much lower percentage, like the one I presented in the beginning, 10 to 25, would say things like, I'm lonely. So it's important to listen to what people in your life is saying. Maybe they're socially isolated, maybe they're heading down that road, and you want to help steer them away. That's the bad news, right? We had to talk about that, set the stage, find out what was bad about being isolated. But I'm really more interested in talking about what we can do to build social connectedness for ourselves, for our families, for our friends, for our communities. And so I'm going to make 3 main points, and there'll be a test at the end, but we'll review the whole way, so don't worry. I'm just teasing, there's not going to be a test. Okay, so I'm an occupational therapist, and that, for me, that means that there's real value in what we do. And so doing something meaningful with our time is something really special and something really important, something that you really like to do and that you really get into. And so doing these activities and roles that have meaning, they help to create life satisfaction and happiness, and they help you to connect with other people. By doing that and connecting with other people and feeling this happiness, you're then more likely to engage in these occupations that bring you all this good feeling and connecting with others. So it's a cycle. It's a virtuous cycle. So think about the activities that you do, that there's some things that you probably have to do, taking care of your house or taking care of yourself or your family. Some people really like their work, some people just put in the time. But what is it in your life that you really find valuable, that you really find meaningful? For some people, it's a special hobby that they have, that they really get into. You know those people that just spend all their time line dancing, for instance. I know some people like that, do it 20 hours a week, and that's their thing, whereas others do other things. And so are those activities, you have activities that you do that you can do with other people. Think about that. Are there things that you do that have meaning that you're engaging in with other people? And if you're not, can you? Can you bring those people in and form those connections with them through doing things together. So that's my first point. The idea that doing things with other people is what is connecting us to them, and that helps to build our social connectedness and decrease isolation and loneliness. So some of my other work relates to talking to older people about their experiences in their neighborhoods. Everyone lives in a community, everyone lives in a neighborhood, and I've talked to them and I've heard things about what it's like and what the benefits are of being in your neighborhood, being present in your neighborhood. And by that I mean you're out on the sidewalk walking, or you're shopping, or you're using the services that are local to you. Maybe it's a drive and you're using the local pharmacy. You're outside on your front porch, for instance. I've talked to lots of people about that. And just by being out there, these people are contributing to what I call the social fabric of their community, right? And we all know this. You see your neighbor when you're shoveling the snow, or you're out getting your garbage and you're waving, you're saying hi. These are important connections that we're making. They're different from our family and our friends, but they're really important nonetheless. So I have a few quotes from what people have told me. So one person said to me, even just that, we said hello to a bunch of people we didn't know. I saw 3 people I did know. We just say we cannot get over how much that means to us, that we can almost go just anywhere and see some people we know just in passing. That's really important to us. And these are people that they maybe don't even know the name of, but they recognize. Another person said you can share a lot of life just in the driveway or over the fence or knocking on the door if you need to borrow something. There's places in neighborhoods that enable this kind of thing, and they're called third places. Has anyone heard of a third place? Yeah, good. So the first place is your home. That's the place where most people are. The second place is your workplace. And the third place are public places that anyone can access, and you can meet other people, do what you need to do. It could be things like sidewalks, as I've listed, local cafes, farmers markets, the mall, nature and wildlife. Areas that contain nature and wildlife are always good. And these are the places where you're making those casual connections. And as I said, they're not the close ones that you have necessarily, but they're the more casual ones that are really helping to surround you in a network, I guess, of social interactions. And so one person said to me, if I'm walking through the mall and past Timmy's and I see a neighbor, I might sit down and chat. And so this is just someone that this gentleman runs into. And I think you probably all know what I mean when I say Timmy's, because we're in Canada. When I talk to the Americans, they don't always know. Some third places don't really encourage interacting with others. So Dr. Wells mentioned exercise, and I think maybe some people go to their exercise and they're just focused. They just want to do their thing and head down, and that's it. But the idea of having your exercise class and maybe a small seating area outside where people can chit-chat afterwards and connect, even for a few minutes, is important. This center right here is a great example of it, where you have spaces to congregate. So that's my second point, that in addition to doing things with others, doing activities to build those connections, being out in your community and building those more loose connections is really important. And then my third point is that we can't do it alone, and I'll talk about that more. So we talk a lot about things that we need to do, that you need to do. You need to talk to more people and do more things. You need to exercise and eat right. But we also need help from our communities, right? We need our institutions to create spaces for us to congregate like this, or informal spaces in the Kiwanis Center. We need our institutions to help us to be active in our communities. And so I think that we as a society need to think about how we can gain that support from our community centers, schools, local government, provincial, federal, to support us all in being more connected to one another. I'm just going to close now. We talked about how bad the effects of social isolation are, and I think that you probably wouldn't have been here if you hadn't thought about trying to reduce some of your risk factors for dementia, including isolation. And so, yeah, this is just what I try to do, and I think you should too. Connect through the activities that give you meaning, be out and about, talking with people, saying hi, even if it's just in passing. It's still a nice connection to make. And then think about getting our institutions to help us to create spaces for us to come together and congregate. Thank you.